heard about significant casualties arriving in Al-Aqsa hospital. And what we found when we got there was that there had been 100+ patients brought in with serious injuries within a very short period, within about 30 minutes, they said, plus about 100 deaths that were brought into the hospital around the same time. And we heard from one of the doctors at Al-Aqsa hospital that they had a stream of patients following that for about the next 12 hours, a significant number of patients.
He's 9 years old.
We've seen children, women, young men, old men and women, people bleeding out. At the same time yesterday at Al-Aqsa, I saw a woman who had multiple gunshot wounds. An attempt was made to refer her, and she was referred back because she was bleeding so heavily. So, I mean, there's blood everywhere in these hospitals at the moment. We're seeing almost only trauma cases come through the door, and at a scale that's quite difficult to believe. It's a bloodbath, as we said before. It's carnage. There's nowhere actually that's safe in Gaza. We're at the UN Joint Humanitarian Operations Center right now in Rafah. Outside the door of this building, 50 meters from where I'm sitting right now, there's a camp of thousands of people who have been settled here, who have resettled here because they've lost their homes or they've fled violence. And they're in plastic sheeting shelters right outside the door. And last night we heard fighting almost all night long, with reports coming in during the day today of many injuries presenting to the hospitals here in the south.
وفد من برا لا ما صار
تشويه له نزيف في الدماغ ابني مسالم.
Across Gaza at the moment, health capacity is at about 20% of what it was 80 or so days ago. So almost all of the hospital beds, almost all of the hospital services have stopped functioning, either because the facilities themselves have been affected, because the staff have been forced to flee, because they run out of power, or they've run out of medical supplies, or the staff have not been able to access them. All of the non-communicable diseases, the cancer patients, the people with diabetes, the people with heart conditions and other conditions, they're not able to access services in most of the Gaza Strip right now. The hospitals are totally overwhelmed. And what we were hearing at Al-Aqsa yesterday is that they don't have a shortage necessarily of surgeons. They don't have enough operating theaters. They don't have enough physical space in the hospital to accommodate the number of patients that are coming. And obviously, when there's a constant stream of people on the edge of death who need life-saving care, they take priority. A limited number of supply trucks coming across the Rafah crossing. And to get supplies to hospitals across the Gaza Strip, we have to plan with the parties to the conflict to make sure that routes are as deconflicted as possible so that we know as much as possible that we can proceed safely. Sometimes those routes change. They have us go through areas that are very crowded. And actually with 2 million people almost displaced, we have huge crowds living in certain areas. Even here in Rafah, sometimes it's hard to drive down the street. It takes 30 minutes to go 1 kilometer because there are so many people in the streets. And then as you go farther north, the level of destruction is so incredible, so significant, that roads are full of rubble. There are down wires, there are down power lines and poles.